Welcome to a multi-sectoral approach to creating a culture of health in rural South Carolina concurrent session. I'm Megan Wise, the Director of Community Engagement at the South Carolina Center for Rural and Primary Health Care. I'm also the Vice Chairman of Eat Smart Move More South Carolina's Board of Directors. At the center, we support and develop sustainable rural and primary care education and healthcare delivery in South Carolina through clinical practice, training, and research. We strive for a future where all South Carolinians have access to high-value, quality healthcare. We do this in many ways, including creating and supporting programs, collaborating with partners throughout the state, and adopting regional and national models. So I think you can see why this session is of particular interest to me, and I'm so pleased to be able to introduce it and to participate alongside with you in learning. Because healthcare providers, nurses to be specific, have an opportunity to be agents of change outside of the clinical setting, especially in rural areas that have vulnerable and underserved populations or lack the resources to positively impact health outcomes and health behaviors. There's a grassroots effort available through the Montalvo International Community Health Initiative that focuses on transforming the landscape of healthcare through a strategic multi-sectoral approach. Some of this work has been happening here in South Carolina. So I'm thrilled to introduce today's speaker, Antoinette Montalvo, the co-founder of Montalvo International Community Health Initiative. I hope you enjoy learning more about a newer approach to improving rural health.
Hello, everyone. Good afternoon. I am so grateful to be able to have this opportunity to share a little bit about Montalvo International Community Health Initiative. As was introduced, and I so appreciate the introduction. My name is Antoinette Montalvo. I am a pediatric nurse practitioner. I am owner of Antoinette Montalvo Consulting and Coaching Services and co-founder of Montalvo International Community Health Initiative. And I'm really excited to be able to just share a little bit of my journey, the importance of nurses, especially at this day and time, to be wonderful change agents and advocates for promoting healthier communities and really being leaders alongside all the other leaders that exist within our current healthcare system and outside of that in a way that will innovatively improve and just increase access to care. At least that's my hope for sure. So I appreciate all those who are joining in on the concurrent session, and I appreciate Eat Smart Move More for extending this opportunity to highlight the role of nurses and those who are advocating in the community health setting that will ultimately and hopefully change the landscape of healthcare. So I'll jump into my presentation. And hopefully I will be able to get the shared screen going for you and just make sure that I get a chance to be a part of that. So I'll wait for that host opportunity to come up, and then I'll be able to share the screen. All right, here we go. Great, thank you. So just to jump right in to the presentation, again, as I mentioned, my name is Antoinette Montalvo, and I have been in rural South Carolina for the past about 3.5 years, but a little bit longer than that in the long run. Just over the course of time, I have family that's in this area, and I have always really had a heart for wanting to see those who don't have access to care, that are underserved, or who are in rural areas or low resource areas, receive the care that they need, whether it's been in rural South Carolina, whether it's been throughout Central America and some of the work that I've done there, whether it's been in urban areas where I've also worked significantly as a clinician, and then especially just thinking about how all of these experiences merge together. And so as I was in some of my heavier clinical rotations and things that I've done as a clinician, as a pediatric nurse practitioner, I came to recognize that especially in pediatrics, you're not only influencing just the child, you are also influencing the family. You're thinking about how is the entire community impacted. Many times there would be so many children that would come into my office with their caregivers or family members, or just whoever might be in their care at that point, and recognizing that there was so much more that went into just the few 15-minute window that I had as a clinician, but recognizing that a lot of the impact had to stem also into the community, as well as into just the family structure. So I'm hoping this presentation can give a little bit of a highlight of that, and also walk through some of the work that we've been doing with this particular initiative, which started off as a project, then really kind of blossomed into just this multi-network opportunity to really connect with many. So I appreciate you being a part of that. So again, as I mentioned, and just a little bit of an oversight, lots of words on this screen, but just to give you a snapshot of myself, again, my name is Antoinette Montalvo. I kind of go by the branding of visionary nurse, and it really stemmed from the starting of the work that we were starting to execute with our community health initiative, recognizing that as a nurse, there was so much more that I had to offer, not only to my fellow nurses, but to the community that I was serving, and especially in thinking about launching this rural health initiative. And so it was really the health initiative was the impetus to expanding even my own understanding and my own vision of what can I contribute to healthcare and how can I be a transformative change agent in the area. So as a result, I ended up launching a consulting coaching business where I serve as a community health consultant and coach and mentor for nurses, where I really try to strategically work with organizations, clinics, communities on how can you think about what you'd like to deliver in your area, what is the community voice, who do you need, what are some partners that you need at the table to be able to bolster some of your community outreach, and then recognizing that nurses are prime agents of change for this opportunity as well. And so thinking about nurses, how can we walk through the process of how you can transform healthcare? We've definitely recognized, especially with just this past year and going into this year and just everything that's happened with the pandemic, especially, even as we present virtually right now, it's changed a lot of things, but it's also unearthed just the potential, especially for nurses, that they have to contribute to the transformation of healthcare and just the landscape of healthcare that exists. So a lot of it, again, with the health initiative, which I'll go into more detail, was really about a community-focused grassroots effort to think about how can we collaborate across the board, and in terms especially of addressing health disparities, especially for vulnerable communities and populations. And then also, as I mentioned, I am a pediatric nurse practitioner by trade, and my heart is really about influencing the communities and the families so that children ultimately have the care that they need. And it's kind of my own self-motto that healthy communities beget healthy children as well too. A little bit of my educational background and how it kind of arrived to this. So nursing was not actually my first degree. Education was actually my first degree, with a big focus on global health, as well as a minor in Spanish. And then in my nursing portion of it as a nurse, and then nurse practitioner in primary care and pediatric primary care, and then with a minor in global health and nursing, one side from Emory University and the other from the University of Pennsylvania. And a lot of those meldings of those educational pursuits really were about prompting how can we dare to change the world, so to speak. And you'll see how that plays into some of my own branding that I've been able to build up and thinking about the strategic role that nurses can play. And so, as I mentioned, I have also significantly traveled and lived and worked outside of the United States as well, primarily in Central America, more focused in Guatemala, where I worked with a clinic and organization called Primeros Pasos, or First Steps, working with over 10,000 community members in that area and thinking about really where all of this started, understanding the community's voice and delivering care that matches the needs of the community. And so all of that has stemmed into a great journey, which you can see some of those highlights there. Just to let you know, I don't have any specific conflicts of interest to disclose. So really just sharing my experiences and how this can hopefully inspire you to think about what your role is in leading healthy communities. So the overall objectives of just this presentation, thinking about providing a framework for empowering nurses to be innovative, especially in their approach to community health. But really this stems into everyone, highlighting the unique skill set that pediatric nurses and nurse practitioners specifically possess to deliver health interventions that address specific needs of children and families. And then just giving you an overview of this grassroots project of Montalvo International Community Health Initiative, and just that opportunity to highlight that, just like myself, nurses, if you don't have a nurse on your team, definitely get a nurse on your team, but nurses really function as expert voices for educating the public on not only pediatric care, but specifically in my direction of pediatric physical, mental, and emotional health and wellness. And now more than ever, we recognize that this is very much necessary. So I hope I can give a broad overview for you in that arena. So just looking at some of the background, and it's actually very interesting. The Future of Nursing 2020-2030 report was actually just released about a day or two ago, right after I actually submitted this presentation in preparation for this summit. And there were so many different matchups, and I'm really happy for that, because it's really recognizing where the future of nursing is moving itself and thinking about highlighting the needs for community health and rural health, and allowing nurses to be instrumental in creating innovative qualitative change for those areas that might have often been underlooked or overlooked or underserved. So in giving some of the background, and some of this information might be intuitive to you, environments that children come from, especially in rural areas, often determine holistically how they carry out a healthy life. And I know we've recognized that it's the basis behind this particular summit to begin with. But specifically, some of the mortality data that I found, and you'll see some of the citations down in the bottom of this presentation. If you go back and check this out later, you can look up some of that additional research, but really thinking about, there was an 18-year period that was evaluated by the Center for Disease Control that concluded that within the nation as a whole, rural children experienced higher mortality rates than their urban peers. And then a similar study when thinking about rural and urban disparities, and I've definitely worked in both settings, they've seen some inverse comparison with life expectancy and levels of rurality. So, in layman's terms, basically more rural you are, sometimes it can tend to correlate with a lower life expectancy. Some of that comes from difficulty in access to care, sedentary lifestyle, diet. And we definitely know, unfortunately, that even for South Carolina specifically, that there's these kind of pockets or sectors. South Carolina, often in my initial research and thinking about launching this initiative, found that it was a part of what was known as the stroke belt. And I didn't even know there was a stroke belt in the United States, and thinking about that even as a nurse practitioner, but following a lot of incidences of heart disease, diabetes, and stroke, especially in rural areas. Again, portion of it might be just because of sedentary lifestyle, but the other piece of just increasing access to care. Obviously, we're starting to see a big change in those conversations, especially that there are a lot who are pushing more efforts towards bolstering and strengthening access to care in rural areas. But when we really think about all of these different factors that influence health and health access, a lot of it is just thinking about social determinants of health. And again, I know that's probably a common terminology for many who might be attending this summit, or for those who are specifically working to strengthen health and healthcare access in a variety of different communities. But just to give that basic overview, is that this is straight from healthypeople.gov for their 2020-2030 or 2030 guidelines. But social determinants of health are really just the conditions in which and the environments in where people are born, where they live, learn, work, play, worship, and age, and how that affects the wide range of health, functioning, and quality of life of outcomes and risk. And so when we think about those social determinants of health, we're thinking about safe housing, we're thinking about transportation, we're thinking about neighborhoods, we're thinking about some of these big conversations that are finally coming to light of discrimination and violence and racism that might be inherently a part of some of the fabric of some communities. Education, job opportunities, income, access to nutritious foods and physical activity opportunities, definitely a big thing, even with this particular summit. And being able to say, is it just boiled down only to urban areas or more well-developed areas, or can the inherent nature of a rural area and the benefit of it, where you do have more, clean living and healthy living and farm access, just being able to create the opportunity that those who need it can access it. And then other things like polluted air and water, and then language and literacy skills, and making sure that the populations that you're serving have access to what they need. And so when I think about all of this, a lot of just even my approach as a community health consultant and thinking about this particular initiative, especially with rural areas, is thinking about how can you meet people where they are. And so we'll talk about some of those factors when thinking about the health initiative. So when you think about healthcare innovation, especially in a community setting or even in rural settings, a lot of times people think it's specifically boiling down to a widget, a device, and all those are good. It's thinking about, upgrading fiber optics and making sure that there is Wi-Fi access, and that is also very important. But innovation in its essence and beauty is not only just new technology, but it's thinking about new ideations. How can you, again, meet people where they are in a way that is unique? It's a unique application to the concepts or the challenges that are being presented. And for me, especially with my health and nursing background, it's just thinking, how can I strategically integrate health and education and leverage multidisciplinary collaborative networks to improve availability and access to care? Many times, especially on a societal level, and especially just with the pandemic, we know the importance of frontline nurses, specifically in hospital settings, at bedsides, in clinics, but also thinking about nurses and the advocacy role and the role they have at the front lines of the community, being able to be at the front lines in terms of teams and understanding how to work collaboratively with other organizations, so that the nurse voice and the clinical voice that nurses provide and the ability they have to assess situations, not only of a person, but of community settings. How can you place nurses at the table to be able to engage the community and bolster some of the efforts that are being implemented? And so I love this quote, and just thinking about innovation and what it entails, and just thinking about how that plays into just the concept of this new ideation. And so particularly this these two authors, when they were talking about the clinical leadership development and education for nurses, just defining it as innovation is defined it's a use of a new mindset. It's in a different context to be able to enable creative linkages that will generate a solution or adaptation to a practice problem. So again, highlighting that understanding that innovation may not just be a technology, it may not just be a widget, but it's also implementing, especially when you think about nurses being advocates, new mindsets, new contexts, new ways, new linkages, new collaboration that will ultimately address some of the problems that exist. So when thinking about pediatric nurse practitioners specifically, again, you'll kind of continually hear me thinking about nurses as change agents. And a lot of that stemmed from the Future of Nursing report that was released actually for the 2010 to 2020 year. And just understanding specifically with that particular report, it was really highlighting, and that was kind of at the start of when I was starting my own community work, the importance of nurses as change agents. And that is carried over into even how I move forward in things, and even changing my own mindset and creating new ideation for myself of what more can I do as a nurse and as a nurse practitioner. When thinking about pediatric nurse practitioners, we're clinicians, we're providers, we're trained to provide in a nursing format, but also to treat the whole patient. So we have the ability to diagnose and treat, but also to coordinate care, also to influence how care is delivered, not only for the child, but for the family or the caregivers. And so pediatric nurse practitioners, in my opinion, are strategically poised to be change agents for children, especially in vulnerable and underserved areas, especially in rural areas or low resource areas that may even stem outside of the traditional clinical setting. Even within South Carolina alone, and I know in other cities and country or in other states, there's also this legislation, but specifically for the South Carolina legislators' Nurse Practice Act, licensed nurse practitioners are actually required to practice a portion of their time in underserved areas. So inherently into our licensure is to be able to serve this population. So we're already strategically in these areas ready to be change agents for things that are worked into our licensure. So for those who may not be as familiar with all the scope of practice of nurse practitioners, I know it's a little bit different in South Carolina. I've also practiced in Pennsylvania, which has a little bit more or a little less restriction. South Carolina is slowly coming forward in terms of just the scope of practice that nurse practitioners have, and thinking about how to meet these needs that are often seen in rural areas. And it's a lot of words on a page, but it's just to give a background and kind of a full comprehensive understanding of nurse practitioners. But pediatric nurse practitioners specifically, we're certified, licensed advanced practice nurses. We've attained our master's degree, some postgraduate certificates, as well as some who have done clinical practice doctorates from accredited programs. And it's really just about treating children from birth to transition to adult care, and especially highlighting and increasing families and caregivers. So some of those things include, obviously, diagnosing and treating common childhood diseases, screening and managing mental health illnesses, managing acute and chronic and critical pediatric diseases. Some of the ones that I wanted to highlight are, for example, providing parents advice on common child health concerns, including nutrition, obesity, weight management. Again, when thinking about leading healthy communities, it's really an important aspect to think about the role that nurse practitioners, especially pediatric nurse practitioners, play when you're thinking about managing some of these chronic issues with nutrition, obesity, and weight management within our communities. Also being able to monitor certain care practices and assisting patients and families in negotiating healthcare delivery systems. Again, another big reason to have nurses at the table in the process. When you're thinking about working closely with an interprofessional team to provide the highest level of evidence of care for infants and children and adolescents, again, it's important to have those nurses at the table. And so in thinking about, again, innovation and the concept of innovation and all the things that come with it, another great quote from this author of Clinical Leadership Development and Education for Nurses, I love just the understanding of broadening our perspective of innovation. Innovation requires that there be a wraparound support system or an environment that incubates innovativeness. And I love that terminology of innovativeness. But if we're not if we're not very much in a setting where we have to incubate innovativeness in rural areas, where we have to come up with workarounds, where we have to figure out how to work these things out, now more than ever, we're starting to highlight that. So I'm just throwing in a quick study that I think really highlights and goes into a little bit of the community health initiative, while I know I'm just kind of tying in some of the summary points of that. But when you think about systems level care, these are definitely areas that I see where you can incubate innovativeness. So this particular study was highlighted in a rural area in Australia, but it was highlighting nurse practitioners. But thinking about the macro, meso, and micro levels of systems of care. And when I talk a little bit more specifically about the community health initiative, that plays into understanding where I saw that I could innovate in these systems levels of care. So micro systems is that day-to-day practice, individual practitioners, what can you do to make change on the ground where you are? That meso level is just your local institutional factors. And I like to think of it as care coordination at its finest. How can you define the parameters of service delivery? And then that macro level is some of the higher level things. And it was great. My moderator, Phil, I'm so glad I was able to sit in on the legislation networking event. But thinking about where can nurses be present on the legal, regulatory, and economic conditions, and being able to influence health policy so that ultimately drives change across the board. So again, on that micro level, some of it is just understanding your roles, supporting your colleagues, interprofessional teamwork. That meso level is thinking about, does the community understand what's going on? Does the community have the support? Are the networks working cohesively? Are local health providers working with other providers to develop some of the things that they're thinking about implementing? And then on that macro level, it's thinking about scope of practice, pediatric nurse practitioners expanding that scope of practice, support for education. So how are future nurses being educated, and then thinking about even state and health service policy and practice. Is there adequate funding to be able to implement some of these things that could ultimately drive a systems level change? So when thinking about the highlights of our own community health initiative, a lot of the approach was, and this was prior to even knowing a lot of these background studies, this was just based off of my own experience, just recognizing that nurses, again, are great at care coordination. They're great at being able to work alongside in teams. Nurses have a great understanding of some of the nuances and the needs and the challenges that their particular patients have. And then they also have an opportunity to critically think, analyze, and strategically evaluate how different methods, innovative methods of delivering care might be better served for that community, whether it's through education, whether it's through working with an area that maybe traditionally isn't one to deliver care, but then actually could be helpful. And it was just evaluating out of all of those things. And I recognized as I was tracking these changes and evaluating in my community and evaluating and assessing what were the needs in my own community, that there were many who wanted to implement change that was much more sustainable in their efforts as well. So for me, I saw what I was doing before I had the terminology as a Miso system level approach. And again, as I mentioned, Miso systems are kind of that care coordination at its finest. It's looking at community settings. It's looking at, are you working, or is the local community health center working with the community? Is it supporting the appropriate networks? So I had this big lofty goal of translating my own critical thinking skills into the community setting, analyzing, assessing, if you will, the community's needs, seeing the community as a patient as a whole, recognizing, where are the food deserts? Are people having a hard time accessing because of transportation or because of where the clinic's located? How is the community and the health provider, how are they engaging in each other? Is the health organization speaking to the community specifically of their needs? What kind of workshops are being designed that focus on wellness and prevention, especially in the chronic disease factor? And that was another thing that was actually highlighted in the Future of Nursing report, and just understanding the importance of prevention and focusing on that. And then just creating new opportunities to collaborate across work sectors. And so for myself, a lot of that came into just continuing to highlight my role and the understanding that nurses are advocates. They are change agents for health access in the community. And they are available to transform the traditional approach to healthcare. And just recognizing that as I was, kind of uncovering this vision for myself, hence the tag name of Visionary Nurse, I recognized there was, unexpected challenges, but ways that I could be a helpful force for delivering care. So other things that I started to do as I started to coalesce some of this community health initiative, and also encouraging and coaching other nurses to do the same, joining my small business advisory board and recognizing how can, as a nurse, I influence the needs that small businesses have in terms of the health sector. And this is now more than ever. This was prior to the pandemic coming into play, but now more than ever, nurses needing to be in the small business and business sector to influence and advise how businesses open up, what they need to distribute what is helpful. Delivering screenings at town events, libraries, and churches. And libraries and churches have been a big focus area of mine, of thinking about, again, meeting people where they are, delivering care in library settings, thinking about staffing a library with a nurse to be able to do some screenings or education, providing relevant engagement on local radio stations, as well as thinking about how to collaborate across sectors. So I was able to lead a coalition, and this picture here that you see, working closely with the local United Way, helping distribute backpacks, but also being able to use that as a point of contact for health education along the way as well too. And so some of the big lessons learned, as I try to kind of wrap this up quickly for you, is thinking about just all the pieces that came with it. It wasn't that straightforward. There have been a lot of pieces that continue to develop. There's a lot of opportunities that I've had to network across the board, from schools to hospital administrators to local coalitions. But just recognizing that education is key. Just because a population doesn't know why they're accessing care doesn't mean that they don't know that they don't want to know about their care. A lot of times I think it's very easy, especially in the clinical setting, when you're kind of moving very fast, to think, oh, someone just doesn't want to participate in their care. But sometimes there's so much going on, there's so much activity that they don't even know what they don't know. So just being able to set platforms and areas and arenas to enhance the education that goes behind why certain care is delivered, or what kind of things you can do to prevent further exacerbation of chronic illnesses. Collaboration is huge. So especially in rural areas, and that was something that I was able to really highlight in this past year, working virtually and remotely, and then collaboratively with a variety of different organizations, ones that were doing food share and addressing food insecurity, ones that were addressing how to strengthen the mental health of the children and youth when they were out of school. And so really being able to leverage, again, as a nurse advocate, some of those areas to be able to drive more sustainable change. But thinking about that, it's necessary for many different organizations to collaborate across sectors. And then prevention. When considering sustainable points of entry for community engagement advocacy, prevention is such a key thing. When any intervention that you're thinking about, you want to make sure that it's sustainable across the board for prevention, in order to make sure that your change isn't just addressing the acute problem, but it's thinking about the long-term impact as well. So one of my own personal quotes, because again, when I was starting the health initiative and people are trying to understand, but you're a nurse, are you still a nurse? What are you doing as a nurse? And I recognized, that your unique experience is important, despite whether others get it or not. And only now, before innovation was a buzzword and before the highlight of nurses and the role they can play, I recognize that there's a problem. I have a skill set and I have a vision, and here's a way to implement it in a way that may look beyond the traditional setting. And so recognizing that, sometimes in those initial points, people may not get it. Even now, as I work with the community health initiative, sometimes people still want to know what's the big goal. And a lot of it really just boils down to cross-sectoral collaboration, so that you can meet people where they are in order to implement care that can ultimately improve access. So I appreciate each of you and just the opportunity to be a part of this concurrent session. I encourage you to connect with me. And as I continue to work as a community health consultant and coach and mentor for nurses, I'm always about inspiring nurses, but anyone, especially those who are working to improve healthy communities in any way, shape, or form. So I appreciate the chance to present at this summit, and just thinking about the impact that can not only be established now, but for future generations as well too. Thanks so much. So I'll check in with Phil to see if there are any.
Yeah, hey, it's Phil Ford. I use he and him pronouns, and I am the policy and advocacy consultant for Eat Smart, Move More. Antoinette, thank you so much. This was fantastic. And a lot of what you have talked about are kind of new concepts to some of the coalitions that are working around the state. But I think that it's so important to have a resource like you willing to share. So thank you so much. For the folks watching, please put your questions in the Q&A section to your right. And I know that we have one question already, and that is, what coalition activity or activities have been most meaningful to you?
Definitely. So I was able to work with a budding coalition that we were able to work specifically with the Blueprint for Health grant all through last year and starting from 2018. And it was through the South Carolina Office of Rural Health. And that coalition was so strategic and so instrumental in being able to really leverage some of my experiences across the community sector. And we were able to come together and just work together as a team. There were, like I said, working in addressing food insecurity, working in addressing how to better educate the community on mental health and wellness, being able to work across and forming even smaller subcommittees that focused on certain pockets where maybe there were a little bit of isolation or silos that many people were working in, really being able to bring much of the voice together. So even just that opportunity to communicate, to strategize, to say, you know what, we're all working in these pockets, but we all want to help the community. How can we understand and leverage our resources more? And especially in last year, many had to collaborate in order to just sustain some of the activities that they were providing. So just the biggest pieces for me was just that education piece, as well as speaking specifically with the library and dreaming and scheming about what are some of the ways that we can use some of those library settings or other areas where maybe you can't get all the way to the clinic, but you know you can get to your local computer. What are some different ways that you can deliver health education around nutrition, around mental health, and everything else in between? So it was really that opportunity to communicate, hear the voices of many different organizations, and strategically thinking about, again, seeing the community as a patient almost, strategically assessing what are the needs, what are the strengths, and what can we deliver in a way that is ultimately innovative for the community. But great question. Thank you.
Thank you, Antoinette. My good Judy, Kia has asked a question, and that is, I have children that are going into the nursing field. What advice would you give them in going into this field?
Absolutely. If anything, I would say keep an open mind and be willing to learn, especially when you're first starting off in nursing. I really think that being a nurse is not for the faint of heart. And anyone who's choosing to go into nursing, I'm always so excited because it really means that you are embarking in something. You are someone who's probably innately just, you love to serve, you love to help others, and you want to do it in a meaningful way. And there's also the practical aspect of being able to influence health for another person. And so just really keeping an open mind as you go into the nursing profession. A lot of times people go in and say, you know, I'm going to go into pediatrics or med surg. I want to work in the ICU. I like the fast pace of the emergency room, but just recognizing that there are going to be many different opportunities to learn, many different ways that you might be able to fluence, and that nursing is very flexible in that way. Once you have those skill sets and once you have the foundation of what it means to deliver care, even from a practical, from vitals to monitoring care, it can be applied in so many different settings. And again, not only in a traditional clinical setting, but even beyond that, because you recognize what are the needs of your community and of your area. So my biggest thing is being flexible, being open to learn, and just being open to the multiple different ways that your nursing knowledge may evolve, even beyond what you may first start off doing. But great question. And I'm excited for that person going into nursing.
Yeah, no, that's fantastic. Thank you. I'm going back to see if we have any additional questions. None right now. So we've got a few more minutes. So I will just cover some housekeeping items just in case folks are still typing their questions in there. This is just a reminder for the folks watching that CEUs for social work and your CHES are available for this session. So please fill out the survey. Again, that is to your right underneath the Q&A section at this, at your link that you're watching on. I'm gonna go back and see, there's a comment here that I'm gonna, here we go. Give me just a second, y'all.
No problem. And I'm definitely always up for connecting with people if there are more questions that they have in terms of just the nurse role. As I mentioned in my presentation, you can connect with me at visionarynurse.com as well too. So it's always an opportunity, especially when you're thinking about just, again, kind of broadening your perspective of nursing. I love being able to just encourage and empower people in their nursing journey because I know it can be so many different things going on and just figuring out how to be most effective in the community.
Yeah, there is a question here and it's extremely timely. I think this was from Danielle. Has there been a positive increase in COVID-19 testing and vaccination in these communities through the utilization of libraries and churches you discussed earlier?
So there's been, I've seen a bigger increase in churches specifically. The libraries haven't been as utilized because I know there was a point where the libraries were still also figuring out being open and being accessible. So now that we have a lot more knowledge and a lot more understanding of just safety guidelines and protocol, at least within my rural area, I know that, for example, like DHEC has been being able to work strategically with church settings in terms of just overall education of safety, thinking about where to find testing sites. And that spans the board beyond COVID testing and vaccinations as well, but even just health education. So a lot of just even the education piece that I have provided, especially before the pandemic, was around some of those chronic disease management, so hypertension and diabetes. So being able to use church settings or library settings. And there's a lot more conversation around the importance of utilizing libraries as a space that is as a wonderful community resource. But I think it's slowly starting to ramp up as things are opening up more and as there's a little bit more safety guidelines that are in place. But I do believe whether in thinking about COVID testing or just health education or educational or nursing interventions in general, even health interventions in general, libraries and churches are going to be your big key points of access, because that's really where you're going to have the most, especially in rural areas, the most face value. But I think that's a great question. So I know there's lots of room to have those conversations and think about it. And it's just a matter of really forming those relationships with your local library or the local places of worship as well. And just being able to explain what it is that you want to implement. Because I think both settings want to do the best for the community. But I think it's really important to work hand in hand with any community setting to really discuss, what that person or what those organizations feel comfortable talking about, delivering, and just being able to educate their congregation across the board, or the members or patrons that visit those sites. But great question.
This is not a question, but a statement, and just as a testament for everything that you're doing. From one of our participants, I'm a community health nursing instructor, and you are truly emphasizing what we are focused on in our course. We have found some wonderful resources in our community to offer clinical hours. So there is one last question here. I think we are wrapping up around 2:25 to give folks time to do the evaluation. But the question is, what has been the most challenging part of being a nurse in the middle of a pandemic?
Definitely. I think if anything, a portion of the challenge is that you just want to be able to do more. You want to do more for your community, but you also want to do more and be well for yourself. And I think that's been the biggest challenge for nurses, is just that tension, that conundrum between being available for those around you, but also being sustainable for yourself. And I think there are many nurses who are coming to that realization that, we are human as well. As visionaries as we are, as change agents as we want to be, we are also human. So just recognizing that challenge of preserving yourself. And it's one of those things that even in my own coaching session that I'm always really adamant about stressing, is that unless you are well, you're not able to provide well care for someone else. And so just really being able to understand your limitations, understand where you have to take those boundaries for yourself, but also being available. Especially during the pandemic, there was a lot of time that I spent just educating my own family, educating community members, educating on what different things, educating, especially when it was kind of new and first surfacing, a lot of people just didn't really know what to think. And so just being able to be a voice and an advocate, and sometimes that can go either way. People will listen to you in the beginning, but maybe not listen to you as much and just say, oh, well, that's just that, or et cetera. And so just being able to stay resilient in that understanding, but also, again, knowing where your limitations lie. Just because in order to be effective for someone, you have to be effective for yourself too. So I think that's been kind of the biggest challenge of that tension and that balance between being available, but also making sure that you just maintain healthy boundaries for yourself. And I think that can go for anyone who's doing community work. There's so much that can be done in the community. There's so much that's needed. And just knowing how to kind of walk that balance in order to stay sustainable for yourself and for the people that you might serve.
I think that is a fantastic note to end on, to be sure to take care of yourself so you can help take care of others, especially with the pandemic, fighting systemic racism, seeing things happening with civil unrest in our country. So Antoinette, thank you.